run through and spray everything down really quick. They even have that little gun, the blue light thing that the fan. What's that one? The one that get ultraviolet. Yeah, the UV. Good morning, Dr. Felix Cabrera from the Physicians Advisory Group. I did a big presentation yesterday. We also got this. Was that the grotto, Doc? That.
Yeah.
Yeah, I was like, uh-oh.
Wet.
I hope
I'm
no
still
other
wet.
pictures pop up.
Yeah.
Let me just dry off.
We got it up on screen now.
Yeah, we got it up on screen. We're gonna put it up just to give you a hard time. But it's funny, Doc, in the comments. I hate it when that happens. First of all, when you try to do a big presentation and your personal photos start popping up. But that was a cool pic, And the comment
Yeah.
was funny. Someone commented like, "Oh, so that's how you defeat COVID? Just stay underwater." Yep, just stay underwater.
Drown it.
Drown it.
Drown it.
Yeah, so that was neat. In some ways, it was a lot more fun to watch your pics at the grotto than to look at the charts that you had put out.
Yeah. Yeah, I can only imagine.
And so this presentation you gave again, when you see the data, because we all know the spike, we're in a surge, the deaths, we all know it's increasing. But when you see it on a chart like that and you lay it out and you see that line just continuing to rise, it's very sobering.
Yes, Chris. And so that's why I think it was a good time to kind of take a step back also, and just so that not only when we look at those graphs, those graphs represent souls, and they represent our brothers and sisters on this island that are struggling, and that some that have pulled through and some that have not. And so it was important that we put that in perspective again. And so with the presentation yesterday, we started out with, again, just understanding the timeline. And when we see these numbers of positives that come up, and that to understand that there's a significant lag until we actually start seeing the ramifications of these positives, and that we end up having a spike in the hospitalizations about 8 days later or so, and then we'll probably see a spike in deaths, or an increase, or the resultant deaths from those positive cases on average about 17 days later or so. And so keeping that into perspective, so what we're seeing right now in the hospital, and what we're seeing when they announce deaths, that's stuff from 2 to 3 weeks ago. I mean, when I say stuff, I mean that those were cases that were reported positive from that far long ago. And so our actions have consequences, but we don't see that, and there's a delayed response. And so, we don't get to have that, that Pavlovian response, necessarily, where you do an action, then you hear a bell, and then you relate it right away. But so it leads to some of the numbness that we have with hearing all these positives and hearing these deaths when we don't connect them directly. But they're all significant nonetheless.
Doc, Dr. Hoa was just on, and like you said, we're 3 weeks behind, and he told us this morning that it's only going to get worse. How bad is it going to get?
Yeah. Well, we only know. I mean, it's hard to say how bad it's gonna get. One of the things that we tried to do was put a bit of a projection of how many patients might be admitted with COVID-19 over the next 2 to 4 weeks, and we're looking at anywhere. Right now we're at 67. We were 67 yesterday morning. We're still 67 today, this morning, as of 8 a.m. And that's the highest we've ever had on Guam during this whole pandemic. And so with these different methodologies to project, we're looking at reaching 100, triple digits, anywhere from 2 to 4 weeks from now. And that's that's very concerning. And we have to remember, that's just the COVID-19 patients being admitted to the hospital. There's all the other sick adults who make up the majority of the other inpatient beds, and then we can't forget our moms and babies, and kids that are also are admitted at the hospitals. We have to remember those that need the hospital for the operating rooms for elective surgeries or semi-elective surgeries. In other words, these are, for example, cancer patients that need their cancers cut out. It's not an emergency, like it has to happen the same day, but they need it done, in short order, and they can't wait months for it to happen. And so it's a strain on the entire healthcare system. It backs up all the way down to the primary care level. But our two main flagships basically are the two hospitals and GRMC and GMH, and that's why on that presentation I had an image there of two really weird looking waves that were back to back, and two surfers on there, and pretty much representing each hospital, and how it's so easy. Professional surfers make it look easy to stay on the board, and we have some professionals in these hospitals, but they can only do so much, and you give them a big enough, choppy enough wave, they're gonna wipe out.
The 67 hospitalizations at GMH, I think, what is there, like 3 over at GRMC? 2 or 3?
Yes.
So I was just going to ask, are we just up at capacity at GMH?
So not necessarily at capacity. Capacity is a dynamic measurement. It's highly dependent on the staffing levels overall. But of the 67 that I speak of, 62 are at GMH, and then 3 are at GRMC, and then the last report 2 are still at Naval Hospital as well. So that brings to the island-wide total of 67. We look at the island-wide because we look at island-wide COVID numbers, and so it's only fair to look at the island-wide hospitalization numbers as well.
No, I'm going off of the report that was issued last night, that there were 67 people hospitalized at GMH, 3 at GRMC, and then the 2 at Naval Hospital. I'm just wondering, like, are patients at GRMC, which was supposed to be the non-COVID hospital, are they there because there's just not enough space at GMH?
Yeah. So so first of all, there's sometimes a little discrepancies in the numbers because of the time of the day. For example, when I report the numbers I give, it's specifically at 8 a.m. Whereas like on the SIT report, it might be later in the day. But that being said, when you see patients at GRMC that are COVID positive, they're waiting for transfer to GMH. So they, in almost every scenario, they present it to the GRMC emergency department, where of course by federal law do not turn anyone away. And then during their workup and treatment there, they are found to be positive with COVID-19, and if they need admission, so then they continue their care at GRMC until a bed becomes available at GMH.
Right. So there's no space at GMH.
Well, to GMH's credit, there is always movement. And that they're just waiting to discharge some of their patients. So remember, when we say 67 today and 67 yesterday, that includes also new admissions and discharges that have a net effect, where you still have the same total amount. So as GMH discharges some of their patients, like to the SIF or to home, that makes more room for the patients at GRMC to move over to GMH. But guess what? GRMC is admitting new COVID patients that are going to be waiting transfer. So that 8 a.m. snapshot is just what the picture is for the day. I'm confident that the 3 patients at GRMC right now will move to GMH, hopefully before the end of the day, of business day, and then we'll see that. But then during the day, they're also going to probably admit more. And we've GRMC has been seeing also the ups and downs with the non-COVID patients, more so the up, and so that backlogs, and then it also means that they're non-COVID patients needing to be admitted into GRMC that are awaiting a bed into the proper part of the hospital where they're being admitted. So they're also being held in the emergency department, and so that backs up the care there. So that's why there's a medical tent that's outside of GRMC's parking lot, and right now that's there because and that's mostly the care for as people come in, because if more people come to the emergency department, they're not going to be turned away. They need to be cared for, but they can't. But the emergency room itself is being filled up with admitted patients, and so there needs to be a safe way to care for these patients, no matter how they present. And so that's why it continues to be a stress on the entire system.
Yeah, and there's just not enough staff or whatever to move GMH, more COVID patients from GMH to the SIF.
Yeah, that's my understanding, and there are there are continued efforts. They have the contract, the short-term contract nurses and even physicians, and I believe they're looking even at respiratory therapists to help in that regard. There's continuing efforts with that. Thankfully, we had the federal assets that came and assisted, and right now there is no direct need for them because we are using these other means, which is more sustainable in using contract staffing.
Doc, as the numbers guy, we actually had a comment too. Where they were talking about your presentation way back in the first wave, saying that at that time it was unbelievable, and that this comment, they're basically like, never thought we'd see the day where we have 3,000 cases. How much more can our healthcare system take, though, Doc? Because we're continuously told that we're bursting at the seams, we're at capacity, but we made those staff additions, right, with the off-island provider for the nurses and stuff. Dr. Hoa this morning mentioned triple digits in hospitalizations. Is that something you guys are anticipating? And could we handle it?
Well, that's what I just said. What I just said earlier, that we could be seeing that in the next 2 to 4 weeks, based on the current trajectories that we have. The hospitalizations over the past 2 weeks as well. And so, point being is that you talk about earlier in the pandemic, during our first wave, we had a high of about 25 admitted patients at GMH with COVID-19. And if you told me later in the year that we were going to see, more than double that, close to triple that, I would say there's no way that we could handle that. Absolutely zero way that we can handle that. And you know what? But with time, and because we've had months to do this, we've been able to do better. We still need to do a lot better because that 67 could double in the next month. And this is not a far stretch of the imagination. We have other areas that have been through much worse than we have, with even better resources. Again, and I always like to compare to the Navajo Nation that encompasses a big part of Arizona, Utah, and New Mexico. And their population size is very similar to Guam. And they have over 10,000 positive COVID-19 cases since the beginning. And they have over 500 deaths since the beginning of the pandemic, 571 to be exact. I mean, can you just imagine that? 571 deaths on Guam if we were on we had the same fate as they do. And so that's it's a lot. It's over, that's 9 times more deaths than we have right now. And that's a very real possibility. And this is stateside. This is in areas where these patients were able to be medevaced to neighboring cities and get, care there. We're it here on Guam, and we have to take care of our own, and we have to do the best job we can. And when I say take care of our own, I'm not just talking about the medical, again, the hospitals are the last lines of defense. Everyone else in the community, you guys, everyone that's listening to my voice right now, you guys are all the first line of defense, and we all have to take personal responsibility. We have to do what we can to take care of each other. And I'll just summarize one of the 4 main points that I made during the press conference yesterday. And what we found with these with the contact tracing and the case investigations as these epilinks, and 4 categories: household contacts, community contacts, workplace contacts, and then healthcare contacts, which is healthcare workers, which is a form of workplace. We've seen a rise in household contacts and workplace contacts, in particular workplace contacts doubling over the last month. So what that means is that people are sick and still going to work. Some people are unknowingly passing it at work, and that's understandable, but that's why precautions are necessary. But people are still passing it, and they're mainly passing it at work. And then when you go home, it's even harder to not pass it at home. And what we're finding is one of the key drivers of that are break rooms. Okay, so when they're very responsible throughout their workday. They take the proper precautions. They wear their mask. They wash their hands. They watch their distance. But then they let their guard down when they get into the break room, or they congregate. And I always say that COVID preys on our cultural values. Well, one of the things that we say how we say I love you to the ones we love is we feed each other. We provide food. We say, come on in.
Come and eat. Right.
And so and how do you know? And at that point, it's very difficult to say no. It's very difficult to participate in that, and you can't eat with your mask on, and and it's a time to eat and talk and commune, and so that's the part that's really difficult. And so I want to make a plea to every business, every workplace, every area, to please refrain from having potlucks. Please refrain from eating your meals together. You can hang out and rest together, but keep your mask on and don't eat at the same time. Eat in separate areas. I'm making a major plea right now because we're finding that as a big source of spread. It's not the majority cause of spread, but it's not helping, and it's definitely hurting. So if we can all make an effort to do that, be conscientious about that, and just understand that that's really what we have to do as part of our personal responsibility.
Thank you for that plea, Doc. It's gone out over the air. Has your whole discussion. We appreciate your time. I know you got to run, so thank you so much.
Yes.
Grab you some virtual cinnamon
right.
rolls on the way out, okay?
Okay, you have any risquetti?
Kevin is sending it from Saipan, so when it comes in, we'll stock the room.
Okay.
Thanks.
Okay.
Esta, okay.
Thank you.
Jos, enjoy your swim.
All right. Okay. Okay, thanks.
Esta. 8:34. Let's keep it going in the K-Wave News Zoom room. We got a little bit of a line flowing. We ask that you please maintain your social distance between each other as we've got public health standing by. We're going to